Since the end of Sierra Leone civil war in 2002, the country has struggled to rebuild its healthcare infrastructure. During our volunteer work in the emergency resuscitation ward, the nutrition ward in the Ola Jurin Children's Hospital, and the health clinic in Krube slum in Freetown, Sibo, a health visitor, Dr. Joe, a medical doctor, myself, a community matron, all practicing in UK, we saw some of the country's most affected and most marginalized groups, mothers and babies. We also saw how the very few doctors and nurses were struggling to keep babies alive and healthy due to lack of resources, very basic equipment with no resuscitation tools. Since April 2010, the government has started to address the dire situation by making healthcare free for pregnant mothers and under 5. In turn, the caseload for nurses and doctors have escalated threefold. Mothers still bring their babies due to lack of ignorance and illiteracy. They bring the babies for care when they are severely dehydrated and malnourished, with dire consequences, of course. In just 2 days, we saw a staggering 5 deaths alone. Those babies' needless deaths were due to treatable and preventable illnesses like malaria, pneumonia, and diarrhea. Overall, while the hospital is making some improvements, for example, each cots in beds and mosquito nets, it continues to face ongoing challenges, including lack of basic supplies like plastic gloves, medicine, and an inadequate oxygen supply.
Well, we're here as part of Project Umubano in Sierra Leone, at the only hospital in Freetown. We've been visiting the Children's Hospital, which is an uplifting but also a deeply upsetting experience. We've seen children who are probably going to die from malaria in spite of the very good care they're getting here. And it's also a place where the Well-Body Trust, a brilliant British charity, works. And I'm here with 2 of our Project Umubano volunteers. Sibo here on my right is a Brent Conservative who works for the Conservative Party in Harrow. What's this experience over these 2 weeks meant for you, Sibo?
You know, this project has actually given us access to see how we can share our expertise as a specialist practitioner working with mothers, promoting maternal health and child health, and working with the nurses here, seeing severely malnourished children and actually seeing them getting healthy. And just this week we want to follow them in the community, and hopefully, you know, the impact we've had sharing with the nurses, that they will continue with this work, and we want to come back here and just to see the progress that is being done next year.
And I've been seeing what Sibo and Uma here on my left have been doing. Project Umubano is normally associated with Rwanda, but we are spreading our wings into Sierra Leone, and the real contribution that our nurses and clinicians have made is fantastic to see.
And you are the health worker, right? You are in the community. Because I'm a specialist health visitor. I do all my work in the clinic and what you are saying in the community. Follow-ups, assessments, So you're doing it as a field training. I want to see that it's what you pass on to your client, your customer. Because I'm a matron in the community and that's my task, are the nurses. Because I know they've been taught with wonderful teachers like Sister Marcel's devoting up time to plan the program, to teach you, to pass the message on to you. But you are the person.
Okay. The better way look at it and the center. Yeah, the center they already give that plugging. But before they give, they are already speaking and see and taking one. Yeah, I don't already begin. I don't take back again.
We were invited to deliver health promotion and sexual health sessions to the street children in the centre in McKinney. Poverty is the single largest factor driving children to the streets. They leave or are driven from their homes because there's no food to feed them and no money for their school fees. When we visited the centre, there were currently about 500 children, aged from 5 to 18. At the core of the project at the centre, there were 6 to 10 youth workers who were once street children themselves. They worked to reunite children who are living on the streets with their families, if not find them foster parents. The project consists of 3 phases. The emergency phase where the youth workers pick the children, including young boys, teenage girls, who actually are prostitutes on the streets. They pick them up in the early hours of the morning, 2 to 3, 4 in the morning, bring them in,
So you better
give
tell
them
them.
shelter,
Because if you don't tell them,
medical
maybe they
care,
don't know. You
clothing
understand?
and counselling in their day centre. Finally, we the volunteers, the health volunteers of the Umubano project, we went to work alongside the nurses and the community health workers at the health clinic in the coastal slum of Crew Bay in the capital of Freetown. The staff who runs the clinic talked about the challenges they face and the daily task they have to get young mothers to bring their babies, to get them weighed, and also being advised about how to feed them. They also have a ward for adults who come in for treatment for wound infections and other diseases due to poor hygiene and sanitation. Every Friday they distribute a corn soya blend with oil and sugar mixed as a porridge to babies who are severely malnourished. And these are called the plumpy nuts, which is a peanut-based paste with the nutrients, which comes from the World Food Programme. When we were there, they told us that they started with 60 malnourished children in the program, and now it's gone threefold. And they discharge them as new ones come in. So Sibu and myself and Stephen, we went round with the community health workers, actually doing a mobile health promotion, advising young mothers in the slums. And you would see in the pictures there, the mothers with their babies in the slums, which are really next to just a couple of shacks with little babies.